Deep brain stimulation now offers the solution for such neurological disorders. So what's deep brain stimulation? Deep brain stimulation is a type of bioelectronics medicine and is a form of a surgical procedure. It mainly targets biological processes underlying the disease and uses nerve-stimulating technology to debilitate motor symptoms caused by the disease. Then you might ask, how do we know which part of the brain to zap? Well, the target area differs for every disease. For Alzheimer's, the ventromedial prefrontal cortex is stimulated. For obsessive-compulsive disorder and depression, the nucleus accumbens is stimulated. And likewise, stimulation of the internal segment of the globus pallidus internus, or otherwise known as the subthalamic nucleus, can greatly reduce Parkinson-related symptoms. Let's now take a look at the system for DBS. It consists of a surgically implanted battery-operated neurostimulator, which is placed under the chest to deliver electrical stimulation to target areas in the brain. These areas control movement, or it can also be used to block the abnormal nerve signals causing tremor. Next, a lead or electrode is implanted in the brain by drilling a small opening around 14 mm in the skull to insert the tip of the electrode. An extension will then be used to connect the lead to the neurostimulator. The patient will use a handheld controller to turn the DBS system on and off. Let's take a look at the surgical procedure for deep brain stimulation. With the help of an MRI or a CT scan, a precise roadmap of the brain with images can be obtained, and this will help to pinpoint the exact three-dimensional coordinates of the target area within the brain to plan the trajectory of the electrode, after which a stereotactic frame will be attached to keep your brain in a fixed position. This can prevent any small movement of your head while inserting the electrode. Next, a skin incision will be made, and using a drill, 2 quarter-sized burr holes are made on the left and right side of the skull to allow the electrodes to pass through the brain. Through the small hole, a recording electrode is inserted into the brain. Brain mapping using thin electrodes is then used to record brain cell activity in the region of the intended target to find the optimal location. The brain's electrical signals are played over a speaker so that the surgical team can listen for distinctive patterns of neuronal activity that indicate the location of the recording electrode. Accuracy of the electrode placement is confirmed by a number of tests, which includes lifting of arms or counting of numbers. These tests are then repeated for both the left sides and right sides of the brain. Once the exact nerve cells are located, the surgeon replaces the recording electrode with a permanent DBS electrode. Test stimulation is performed again. When the electrode placement is completed, a plastic cap is placed over the burr hole to hold the lead in place. A coil of wire is left under the scalp for later attachment to the extension wire and the stimulator. The scalp incision is closed with sutures or staplers, and the bandage is applied. This procedure is usually done while the patient is awake, but it can also be done while the patient is asleep. A sleep interventional MRI-guided DBS allows DBS electrodes to be implanted with the patient asleep in an MRI scanner instead of being awake in the operating room. Parkinson's and dystonia patients may now undergo surgery without having a frame placed in top of their heads and without having to be awake. This is usually for patients who are too symptomatic to undergo awake surgery, or patients who are too frightened or too anxious to undergo awake surgery. 10 to 14 days after the surgery procedure mentioned above, the neurosurgeon will implant the battery pack and the connecting wires. And after a few more days, the patient will return to attach the pacemaker, and the stimulator will be programmed and the medication dose will be adjusted accordingly. More than 70% of patients with Parkinson's disease experience significant improvements to their motor function or how they control their body movements. Brain stimulation is also found to have improved depression, although it has not been widely done. Now, the best thing about DBS is that it can reduce the severity of symptoms. Lower medication doses will be needed, and it poses less risk of medical conditions associated with high doses of medication, which are used to relieve motor symptoms. It is also a reversible procedure. However, it can also have potential neuropsychiatric effects. There are also complications of surgery, and it is also a complex therapy which requires regular neurological follow-up. That's all for now. Thank you.